Welcome to the CIO Evolution. In this podcast, we'll explore the Chief Information Officer's role in executing a new ongoing leadership imperative, digital transformation that promotes agility and resilience. How do CIOs upgrade legacy networks? What are the financial challenges CIOs face? And what are the security measures that are required in the new work from anywhere, mobile and cloud-based world?
Welcome to another edition of the CIO Evolution. I'm Chris Jablonski, Director of CXO Revolutionaries and Community at Zscaler and the host. Today, we're recording over at Sales Kickoff for Zscaler in Las Vegas. It's been quite an exceptional week. And I have the pleasure of introducing my guest, Antonie Falco, a CTO-in-Residence, all the way from Sydney. He's an IT executive and technology evangelist with over 15 years of experience. He has witnessed and engaged in technical transformations, guiding both enterprise and government through rapid change. Welcome, Antonie.
Thank you, Chris.
This is your first time in the U.S., is that right?
This is my first time in the U.S.
And you came to Las Vegas.
Yeah.
How's your experience been this week?
It's been great. It's been great.
So you were at the New South Wales Health, the largest healthcare system in Australia and one of the largest in the world. And you undertook a massive project as, was it like the leader of operations and architecture?
I looked after transformation for really security operations and network operations.
Okay. And there you use Zero Trust architecture to essentially improve the application experience of 180,000 users, addressing 20,000 servers and IoT devices. And you did it all under 12 weeks. That's quite astonishing.
Yeah, look, I mean, fantastic to have a team behind you. I mean, of course, it's not a one-person sport. But I find the fascination in the changes that were made is really when you see an organization that has a need to change, has a willingness to change, and is willing to invest in that change that needs to be done. If you think about the time in which we were doing that, we had a global pandemic. And in Australia, we felt that really hard. It was followed not long after by fires, floods. It was an interesting time. You could almost say pestilences might be the next one that's on the journey there, but yeah, an interesting journey.
And was the impact of that, pushing workers to remote employees, was that the trigger for this transformation?
I think the trigger for the transformation was the recognition by the organization that it needed to do things differently. I don't think you can get to any level of high achievement in transformation without endorsement across the business. And this, in the context of healthcare, that includes engagement patient safety teams. It includes engagement across end-user computing teams. It includes engagement with end health entities who are really the coalface of healthcare.
So were you the change leader that would unite these groups, or at least get the leaders of these groups together to then help instill this need in this project itself?
I was a significant advocate for change. I had the endorsement and the support of the leadership team across the organization. I think that when you undertake, again, the transformational change, you really need to take an organization on a journey. If I look at the example of New South Wales Health, I would say it did a lot of things right. And like any organization, it had some things that could be improved. What COVID really highlighted for us is the need to simplify. The focus of public sector, at least in healthcare, is certainly around the citizen. You can imagine the responsibility of the organization. Patients are number one. IT is not something that comes natural to an organization that is not an IT organization. And it also needs to think about, is it in its interest to own, operate, run, maintain these types of functions? I think it's a complex question. Some would say easy answer. Mm-hmm. The journey for health, and if we take the compelling event, which was COVID, when users needed or clinicians needed to access information, that was made increasingly difficult based on the legacy that was there. It worked well. It was robust. It was solid. It delivered on what it needed to do. But the recognition was it should be easier. So how do we do easier? Well, we have to reimagine and rethink how we move forward. So a lot of the work with the teams was really focused on starting with the user. And the user in this instance is going to be a clinician. So if you think about the day-to-day of the clinician, they want to be able to serve their patient and they don't want IT to get in the way. And that doesn't mean they're creating a hostile environment. They want IT to be the indistinguishable from magic conversation. They want to be able to walk up to a workstation on wheels and use that device to access the information they need in a timely manner, such that they can attend to a patient. Sure, there's tools. There's many ways to make that work. You could use tap and go passes. You can use biometric readers for the initial access components. But ultimately, what we need to be concerned about is making sure that that device, which has access to sensitive information, is secured. And if you can appreciate that a system that has over 1,500 facilities, roughly 220 hospitals, 15, 16 base hospitals, that has a significant complexity when you think about wired, wireless, campus infrastructure, the investment in end of life and replacement, the difference in the user experience that's being done. You may have a clinician that can go from hospital to clinical facility, and they may have a very different experience. In fact, they probably will have a different experience for no other reason than technology's evolved. You imagine the investment in infrastructure for the type of organization that someone like health is, and it may have a spread of 10 plus years of technology. If you think back 10 years, very different.
Yeah. So is the idea then for a clinician to be able to have a standardized and seamless experience, regardless of which, access point they were at or, mobile workstation they were logging into? Was that part of the objective for perhaps there's a productivity gains and other things that were measured as far as that end user experience is concerned?
Absolutely. Think of it in the complexity of healthcare and the size of the number of clinicians. So as we went through COVID and we expanded the workforce, there's only so much you can expand before productivity is needed at excessive levels. And that's evident if you look at New South Wales Health's annual reports, where they look at the FTE, the actual full-time equivalent effort to do something. It's important to recognize that if we can save minutes each day for each clinician, the compounding impact for those users is incredible. But the benefit is a patient experience. The benefit is clinicians' experience in being able to serve their patient. So absolutely, if you think about the most basic premise of this, if you've got a workstation on wheels, you're not plugged in to a wall. You're using a wireless capability. And the inherent complexity of wireless is it is largely a licensed spectrum, but it's a shared spectrum. And the technology for wireless has evolved over many different iterations over the last 10 years. Now imagine that you go from one area of a hospital to another area of a hospital, and they haven't been redeveloped for 10 years apart.
Right.
It's a very different experience. Now, how do you identify the investment? You need to know what the user experience is. Now, if you have to pick between 4 different hospitals and one of those has a user experience score that is, let's say, in the red, do you invest in infrastructure that's close to end of life? Or do you invest in infrastructure where you're causing an issue to clinical care? And that's often a choice. And you would think, well, both. Of course it's both, but you need to prioritize. And the first must always be clinical care.
Right. Then you slowly deprecate the other piece. Right?
Absolutely. But the complexity is security. So as you try and optimize your investment, the exposure now becomes, how do I protect my assets when I'm now extending the life of those assets? Well, I need to put some sort of security mechanism in place. The vulnerability patching will get you so far, but let's look at the complexity of an organization. And I'm not saying health does this, but certainly if you look at the broad context, you may have Windows XP machines still sitting in the environment. You may have Windows 10 machines sitting in the environment, Windows 7 machines. how do you get to the sheer number of devices that need to be updated? This could be a workstation for an MRI or a clinic machine. It may be an end user's workstation. And so for me, the zero trust component was really to make sure that health could deliver on its commitment to its citizen, deliver patient and clinical care, but do so knowing that it has a layer of protection that is modern, that is continually patched, continually upgraded, without the need to interact with it.
Right. And that way you're coexisting with the legacy infrastructure that will take some time to eventually sunset.
Absolutely.
Out of curiosity, there's also the physical security aspects of these environments where nurses and staff, they need to use badges to get access to medicine or certain closets and certain rooms. Did Zero Trust for New South Wales Health extend to those things too, or is it limited more to the devices?
I think the journey at the moment really focused on the workforce. That's the primary key here. I think the things that need to be addressed are things like tap and go, making sure you get a ubiquitous experience that effectively becomes muscle memory. The organization will go on that development towards operational technology. And we have seen, not just at public sector healthcare, especially in New South Wales, we have seen an evolution of, do we start looking at things like facial recognition for being able to walk through a gate rather than a tap and go? Because you've got to think of the context of, there's generally going to be, I'm not going to call it a hostile environment, but certainly there's going to be infections and viral capability across the clinical setting because you have patients coming in that are unwell. I think it's important to recognize that anything we can do with technology that means we can stop the spread of those viruses, the more we can use less of our hands, because the hands are the things that are helping the clinician do their job, only serves really to get a better clinical outcome for our customer.
Anthony, you have a fascinating background because not only have you done healthcare, which is a subset of public sector, but similarly education as well. And it looks like you have telecommunications, on your resume.
Sure.
So how would you adapt your network modernization strategies as you look across these different sectors? And what are some of the common challenges and some of those that are definitely different?
Let me think about the education one for a moment. The challenge in Australia is, we'll call it tyranny of distance. The cost to deliver connectivity is increasingly going up in price. And that is a recognition that technology is becoming more complex to deliver, but also the reach for terrestrial-based connectivity, especially fiber-based connectivity, as opposed to those such as the satellite and the recent innovations that have happened across the web. I think the piece that we need to look at when we talk about Zero Trust is, how do we make sure that students are able to gain access to an education system that wants to educate them? How do they get that access? How do we make sure it's ubiquitous? And if you think at the extremes, look at Australia, look at America, and look at what happens when you go 2 hours outside of Adelaide. The example I use here is South Australia. The program they ran to enable the Indigenous in regional communities was phenomenal. And you start to see users that have never had access to internet. And that's quite confronting because we take it for granted in the metro. We just don't, we don't think about it. It's almost, you could almost say rail systems are almost in the similar vein in terms of we have so much connectivity, we effectively get anywhere we need to in a reasonable time frame. And then we think about the complexity of the education environment and what they're being exposed to. And where Zero Trust really makes it different is that we can take that individual user, that is a student, and connect them to a SaaS service and protect them for the duration in which they need to be connected for the service to be delivered by a public sector. It doesn't mean that it needs to be on full time. It may be a BYOD device, but what it does mean is that you can engage in education while being secured. We can make sure that that user, when they're trying to access content, is being moderated.
And here, just to be clear, we're talking about a student accessing perhaps like an admissions portal, or they're trying to download their coursework, or it could be things like downloading their transcripts from the records office. Is that right?
Absolutely. So let's think about, how do you make sure that you, for example, and I'm a big advocate on the user experience piece, you probably heard.
Yeah, I could see that. And that's a great thing, because you bring it right to where it matters most, right? So
let's talk briefly for the user experience. If you have a teacher that is trying to deliver a course and your students are struggling with that course, one of those challenges, especially in a place that has regional context like Australia, is how do you make sure that they're actually getting a good collaborative environment, a good collaboration experience? It could be Zoom. It could be Microsoft Teams. The fact that we are able to measure on an individual participant basis, what's called effectively a mean opinion score or voice quality, means we know when people are having a user experience issue. We know that post a session that we may need to follow up with that individual and find out why that experience is a problem. The benefit we have with the digital experience capability is we can also see why the problem exists. It could be because they're running on satellite. It could be that somebody's using an Xbox in the other room and a student and maybe their brother or sister is trying to learn. And we'll see those elements. We'll see whether the wireless in their home was not necessarily up to scratch.
Right. So here's a case where the end user experience monitoring is monitoring an experience that is happening and playing out in real time digitally. And you got to be able to decipher, if you're a teacher, whether or not it was something unrelated to the student's ability to comprehend or get to digest the material, is why the reason they're falling behind. Maybe it's simply because of their connectivity.
It absolutely could just be because of the connectivity. To come back to the healthcare context, my original context was, if I have a building, two ends of the building, opposite experiences, a clinician can't fix that experience. Apart from working at the one end of the hospital, that's a problem if the patients are at the other end. Same thing when we talk about a classroom. If we virtualize the classroom, how do we make sure everyone is getting a good experience? Now, we talk about investment. A lot of state healthcare, but for at-home care, or a lot of state education, invest in end-user devices. How do they make sure the end-user device is fit for purpose? How do they make sure, especially for those at social disadvantage, how do we make sure that we're delivering them a good experience? The last thing that I believe anyone would want to know is, we've gone and invested in a device that's not fit for purpose, and we've not recognized that. And so this is the proactivity of it. Right. If we can make sure that we invest in the right end user device, we make sure that we can ensure that the home setting that they're having their student experience from is the right setting and it has the right technology, or we have investment programs around that to do that engagement, then we know that from a technology standpoint, they're set up for success. Then we let the teachers do what they do really well, teach, right? Engage with their student. They know that technology won't be the barrier.
Yeah, and this is what we call business outcomes. In this case, it's just a citizen level educational setting.
Absolutely.
So, Antonie, let's now transition because you left that environment to work at a vendor, right? You're now at Zscaler. What do you wish that your successors will do with the legacy that you left behind?
Look, I hope that the journey towards the zero trust capability continues to evolve in the way that sees a positive outcome for the citizens of New South Wales. What does that look like? It means simplifying the way in which IT is operated to the degree that enables healthcare to be more efficient. Less firewalls, less switches, less infrastructure, and more focus on services. More focus internally on engagement and enablement, clinical systems. That's what I hope my successors look at, that they don't look backwards and think that going and buying a SD-WAN construct in the legacy construct of an SD-WAN and think that that's actually going to deliver security. Because ultimately we know that connecting networks to other networks, whilst it has worked in the past, does not work for tomorrow. We need to make sure that the premise of a user connecting to an application for the time in which they need to, and only when they've gone through an identity process and a risk process, that we make sure that they get access to that information. That's the only way I think that we need to move forward. And I hope that successors take that. And I do believe they will. I have seen some really positive outcomes coming from that team.
And having been at Zscaler for a little while now, you probably have seen your counterparts in other regions helping other IT leaders overcome similar challenges. Any observations in terms of how far or behind, say, Australia public sector may be compared to European markets, US, other Asia locations?
This is interesting, actually, because when you're inside, for example, the healthcare setting, I almost want to use the visa example. In Australia, we use tap and go quite a lot. In America, I keep signing my name. It's just the adoption and innovation is quite different in Australia. It's a good nucleus for the use of new technology. And then you look at the setting that New South Wales Health has actually achieved, not on a journey to, it's actually achieved, and it's going to continue to evolve. It is, in some ways, a leader now. It is educating other healthcare systems. If you look at comparable systems, maybe the NHS, maybe Canada, we're talking to, for example, a similar system in Singapore. I look at what health has achieved, and it's phenomenal. That's, again, it's not one person. That's taken a significant amount of organizational change to get there, but absolutely, I think New South Wales Health has really achieved that leadership status. And I should be exceptionally proud of achieving that.
Yeah. Well, congratulations for leaving such a great legacy there and being a champion for this modernization. At Zscaler, as a CTO-in-Residence, what does your day-to-day look like?
My day-to-day engagement is really trying to make sure that our account executives, our solution engineers, our product management teams all come with the customer in mind. Potentially the customer's customer. If we talk about the best of partnerships, what I really love and enjoy about the in-residence team is the initial conversation we have with a C-suite executive is to really try and find ways to partner with them. And the evolution of that relationship is one where I actually want to sit next to our customers and help them effectively, I'll use the term sell given the organization, sell to their customer. I was in a recent meeting with a manufacturing customer of ours, and we sat next to the global CISO, and they got to actually sit back and watch us sell on their behalf into their team. In fact, it was to an application development team around why should I put ZDX on a laptop designed for compiling software that they use to deliver services to their end customers. And our argument is it's investment. How do you know whether there is external impacts to things like compiling code? You don't. We monitor CPU, memory. We monitor statistics. We can do deep tracing. The amount of analytics we have is incredible. So I would say that's really what I've seen, is that impassioned engagement across the region.
In that case, the global CISO was already a champion.
Absolutely.
And he just opened the door for you to go in and influence the rest of his team.
And that takes trust.
Yeah.
It takes deep ingrained trust. And that trust is earned day in, day out. You have to invest in that relationship. And that's not having a conversation once or twice. That's really trying to understand what makes them tick. How do they get success? How does their organization get success? You have to want to walk into the customer and know that the best thing you can do is leave them in a better place when you've left that customer, whether that's a meeting, whether that's an engagement, whether that's trying to inform their customer. Look at the ICICI Bank, I think it is. Look at that engagement. Fantastic engagement. We talk about changing the conversation. We talk about ZDK,
Yeah.
the development kit for end user experience. We're now getting to that stage where we are now sitting between the end user, the far end user in an application piece of software, integrating our zero trust capability before it even gets to the organization. I mean, these are fascinating conversations because they're innovative. And if you look at CISOs, I think what excites them is new technology, new capabilities to help them deliver. What maybe doesn't excite them is another incident to have to respond to.
Absolutely. So one more question for you, because we've talked about the CISO, we've talked about infrastructure leaders, architects, operations to a deep degree, but this is the CIO Evolution podcast. So how can leaders like yourself or those in your position at other companies work and collaborate better with CIOs to get digital transformation projects to a point of success?
Network, I think, is probably the key word here. I believe that we need to see more engagement across CIOs. There has been, for the last few years at least, considerably, a mass move towards public cloud and hybrid cloud. And we're seeing that the implication of cost of living globally is impacting and changing and shaping where we're headed. And what we want to really see is CIOs looking at, where does my data actually reside? Should it be on-premise? Should it be in the cloud? What am I trying to address? Egress charges? How do I optimize my capability? I think the CIO's role is extremely complex. You're wearing many hats. The CTO role, largely speaking, tech evangelist, many hats. We kind of get the cool job. We get to go find new tech. The CIO, largely speaking, is an application-orientated role. They're trying to keep the lights on. They're trying to patch. They're trying to keep up with a CTO saying, this is new technology, and a CISO saying, here's more guardrails. So, there's have to be a level of empathy for the CIO. So absolutely network. I mean, look at the engagements we have with the CXO experiences that you have globally. The value of those types of experiences is, we know that those customers have shared experiences because they're Zscaler customers. But we also know that they're also using other world-class technologies, ServiceNow, for example. We know that we integrate with ServiceNow. How do we make sure those customers can exchange those experiences? Absolutely. Networking is absolutely the common word that I would use.
Yeah, I've never heard of that example before. We know it happens during networking, that they're not going to just talk about the reason why they're together, but all the other ways that they intersect, whether it's the business model, whether they're using public, hybrid, those are all on the table as well at these events. So that's
absolutely. I've seen customers, CIOs, CTOs, CISOs, get a WhatsApp group, chat to each other. You would be amazed at what your counterparts know. If you look at the experience, I say often when we talk about the team, 24 people sitting in an in-residence role globally has the combined experience of around about 500 years. It's a lot of experience.
And that's the cornerstone of community, right? Which is basically what this is all about at the end of the day.
Absolutely. And that's amazing. But then you look at your CXO experiences capability, and you may have, how many of you people do you have at the event?
Could be up to 100.
Now, how many of those probably have 20 years plus?
The majority.
Well, we're 2024, and you now have probably more than 2024 years of experience in the room. So you can imagine that capability coming together and really sharing. I mean, that's the power of community, absolutely. But that works when you have, in some ways, more than just common purpose, common technology understanding, common industry, common trust.
Yeah.
That's when you really get that synergy, because it's very difficult to have two organizations, completely different tech stacks, exchange conversations.
Yeah. And being on the team that helps put on those shows, it is quite the feat to see all the work that goes into making sure that experience is designed that way to facilitate those things that you just mentioned. Anthony, any final words you'd like to leave with our audience today?
I would say to my counterparts in the in-residence team, but also those that are working in the technology industry. Specifically, let's talk CIO, CTO, given the alignment to the role. The art of possible is beyond buzzwords. Really think about putting everything you have to one side for a moment and work out, if I got to start again, what would that actually look like? Would I go back through the same process? Would I keep the same technology? Do I really want another box in a data center that I have to patch and manage? Again, you'd be surprised how many people don't actually know it's in their data center because they know the brand, but they probably can't visualize the infrastructure because they've been off tools for a while, and tech debt is incredible. I would say definitely ingrain art of possible and do that in the teams that report into them and do that in adjacent teams. What is the end user experience going to look like? What is it really going to look like? How do we all contribute to getting that experience if we all agree? There's a really good saying I've heard, especially recently: high-level agreement and deep alignment. Gain high-level agreement in the organization and then go in deep and have alignment.
Powerful words. Great advice, Antonie. Thank you very much for your time today on the CIO Evolution podcast. Antonie Falco is a CTO-in-Residence, APJ, for Zscaler. Thank you for your time and safe travels back to Sydney.
Thank you.
Thanks for listening to the CIO Evolution. Check back with your podcast provider regularly for more episodes. You can find more episodes along with other podcasts on the CXO Revolutionaries website at revolutionaries.zscaler.com. Statements by Zscaler podcasters and guests are informational only and should never be construed as legal advice. You should consult your legal advisor on matters related to you or your business. Zscaler makes no warranties, express, implied, or statutory as to the content of this podcast, and it is provided as is. Content on this podcast may contain forward-looking statements that are current as of the date of the recording and subject to change. These statements are subject to the safe harbor provisions created by the Private Securities Litigation Reform Act of 1995. Full legal disclaimers are available at revolutionaries.zscaler.com. Copyright 2021.